Hi, I'm Rebecca and I'm Chair of the Worcestershire Maternity Voices Partnership. The MVP is a partnership led by service users who have recent experience of using maternity services themselves. In the MVP, service users work in partnership with the professionals who deliver maternity services to try to ensure maternity services are improved with the experience of service users at their centre. As MVPs, we really champion the importance of birthing women and birthing people having the information they need to make informed choices about their care. New parents often tell us that they would have liked better information regarding induction of labour and wanted to be better supported to make an informed decision about whether induction was the right decision for them and their baby. There are a wide variety of reasons why you may be advised to have an induction of your labour. If you're advised to consider an induction, the doctors and midwives caring for you should fully explain why this has been advised, what the possible benefits and risks are of either agreeing to or declining an induction, what your alternative options are, and what the process of induction of labour would involve should you decide this is right for you and your baby. Your medical team should answer any questions that you have. This video is intended to explain what the process of induction of labour involves. We hope this, alongside the other information you should be provided with, will help you decide whether induction of labour is the right decision for you and your baby. And if you do decide to have your labour induced, that it will help you feel better prepared and informed about what to expect.
Hi, my name's Natalie and I'm a midwife based on the antenatal ward at Worcestershire Royal Hospital. Induction of labour may be offered for many different reasons. For example, if you are past your due date or there are any concerns about your baby's growth. If you make the decision to have an induction of labour, in partnership with your doctor or midwife, the induction of labour will be explained fully to you and written information can be provided if necessary. Midwives and doctors are very happy to answer any questions you may have. You will be given a time frame when induction of labour will take place. This video describes the different types of induction of labour. We will show you the hospital areas where induction of labour might take place and advise you on what to expect during the process. Consider completing your personalised birth plan on your BadgerNet Notes app with induction of labour in mind.
Hello, my name is Rachel Duckett. I'm a consultant obstetrician at Worcestershire Royal Hospital. Induction of labour is a common process. Approximately 35% of women within the county are induced. Like with spontaneous labour, we cannot predict how long the process will take. For some, it may be a few hours, but for others it may take a few days. We recommend considering your childcare or pet care for at least 5 days. However long this process may take, we want you to feel supported and aware of your options.
Hello, my name's Megan. I'm a midwife at Hereford. It can be helpful to see induction of labour as a journey that could take many different paths, all aiming for the same goal, the safe delivery of your baby and a positive birth experience. Before you attend the hospital for your induction, you may be offered a membrane sweep. This is not a formal stage in the induction of labour process, but some evidence suggests that it may increase the chance of spontaneous labour. You can find more information about membrane sweeps in the Induction of Labour leaflet, which is available on your Badger Notes app, and your midwife will be happy to discuss this with you. How induction of labour happens. If you decide to be induced, you will be given a time frame for your induction, when your induction should take place. You will also be given a time and date to call your maternity unit to arrange for you to come into the hospital and start your induction. When you ring up, you will usually be given a time to come into the hospital. Often this will be the same day, but sometimes when the hospital is very busy, you will be given another time to call back, or you may be invited in for monitoring. Waiting time is managed based on clinical needs and is continually reviewed by staff. Please click the links attached to this video to view the ward areas. When you come into hospital, we encourage you to bring a support partner with you. When you arrive, you will be welcomed to the antenatal ward, we will do an antenatal assessment similar to the check you have with your community midwife and check your baby's heart using a heart rate monitor called a CTG. This can take about an hour. After this, we will offer you a vaginal examination. This will help us to advise you on which options for induction will be best for you and your baby. ProPes is a tampon-like pessary which we place next to your cervix, which is the neck of your womb. It slowly releases hormones that help the cervix start to dilate and open. The vaginal examination will help us to know whether this is something we would advise. Prostin is a tablet that we place next to your cervix. It also releases hormones and works in a similar way to ProPes. A balloon catheter is recommended in some circumstances, for example, if you have had a previous caesarean section. This is a soft plastic tube that is inserted by a doctor through the cervix. A small balloon is inflated with sterile water, which then puts gentle pressure on your cervix and helps it to open. Your doctor or midwife will support you to decide on the best option for you and your baby. After the insertion of the ProPes, Prostin or balloon catheter, we will listen to your baby's heartbeat and then perform another CTG when your contractions begin. This will be a different time frame for all birthing people. Monitoring during the induction process will be individualised based on evidence and your wishes. In some instances, you may be able to go home to continue the induction of labour process. Please ask your midwife about this.
Some women will go into labour soon after the induction of labour process has started, and for others it may take longer, and some may not go into labour at all. Although this may be frustrating, all these responses are completely normal. Whilst on the ward, we want to encourage you to keep yourself entertained and comfortable, so please bring with you your own devices, such as books and headphones. Pregnancy pillows, eye masks and earplugs are also useful. Please involve your birthing partner in packing your hospital bag, as this will help them to find anything you need during your hospital stay. Some people will go into labour within a few hours of the ProPes, Prostin or catheter being inserted. As much as possible, try to treat this early stage of labour like you would if you went into labour at home. It is good to remain mobile throughout the induction process. Please ask for a birthing ball if you would like one. We have plenty of those on the wards. Meals will be offered to you throughout the day, but you might like to bring your own snacks and drinks. Your support person may also like to bring food with them, as they will not be provided with meals on the wards. We encourage one birth partner on the ward to provide support during the induction of labour process. Please check with the ward for the most up-to-date visiting times. You might like to think about the different pain relief options available to you, such as TENS machine, massage, bath and hypnobirthing. If you wish to have anything stronger, your midwife will be happy to explain the various options that are available to you, such as paracetamol, codeine and pethidine. You might like to consider pain relief when completing your personalised birth plan on your badge and net notes. Once you are in established labour, you will move to delivery suite.
Breaking your waters may be recommended to you as a stage of the induction process. This might be after ProPes, or a ProPes might not be necessary. Breaking your waters is done on the delivery suite by inserting a small plastic hook through the vagina and popping the sac of fluid around your baby. There may be a delay in transfer from the ward to delivery suite during busy times, but please be reassured that midwives and doctors will monitor your care during this time. For some women, the option of waiting at home may be discussed. Once your waters have been broken, we will discuss the option of starting the hormone, syntocinon, via a cannula, or waiting to see if labour begins by itself. The cannula will be inserted in either your hand or arm and connected to a drip. Syntocinon is a synthetic hormone, oxytocin. The rate of the drip will be altered to optimise the strength and frequency of your contractions. Once the syntocinon drip has started, you will be on your own room in delivery suite and your support partner can stay with you. When you are on the syntocinon drip, we will need to monitor your baby's heart rate continuously. This can make it more difficult to move around, but midwives will continue to encourage you to be as mobile as possible. The hormone drip does not cause contractions to be different to those experienced during spontaneous labour, and you will have the same options for pain relief available. These include TENS, pethidine, gas and air and an epidural. Ask your midwife and doctor about this at any time.
We cannot predict how the induction of labour will progress. If we think you may need further assistance or intervention, we will thoroughly discuss this with you and your support partner. Plan of care may change during your birth. This will happen in partnership with you. Midwives and doctors welcome questions and will support you to be an active participant in your birth at every step of your induction. Regardless of how or where you gave birth, we will do our best to make your experience an enjoyable, positive one.
Hi, I'm Jess and I'm actually a midwife here at Worcester, but I'm going to reflect on my experience as a new mum after I did have an induction of labour myself. And this is baby Mia. She's 10 weeks old now and she was my first baby. I was considered a low risk pregnancy prior to when I was actually offered an induction of labour, and I was offered that because I was a couple of days overdue and my blood pressure went quite high. So they recommended that I started the induction process immediately. I decided to accept it just in light that I might have preeclampsia and I was worried. And even though I am a midwife and I'm aware of the process of induction of labour, I felt really anxious and quite tearful about the change in my plan of care and that it might affect my birth experience of what I had, in my head, and I was quite scared. But I need not have worried, as the midwives and doctors were really calm and kind and reassuring and kept me really informed the whole time. The midwives did check me and Mia over, and after a vaginal examination they recommended I have a pro-pes pessary, and as a midwife again I knew that the process could take quite a few days. So I spoke with my birth partner and told him to hold off taking his paternity leave in case the labour doesn't start for a while. I was very lucky though, and my labour started about 12 hours after having the pessary. I felt very lucky that my contractions did start only 12 hours after having the pessary, and the midwives were really supportive during that time. They regularly offered me pain relief, they got me the birthing ball, and they advised me to get my birth partner back in for a little bit more support. After a little bit of time, I was offered another vaginal examination on the ward because the midwives thought, things were progressing, and I was really pleased that I was already 6 centimetres dilated. And they took me to delivery suite at that time, and Mia arrived only 2 hours after that. So overall, it was a good experience.